Good morning, good evening, good afternoon, whatever time it is for you. Today I'm going to do a segment on aloe vera. And this looks a little large there, but this is my aloe vera plant. Actually, I have two of them. And I got these at, oh, I made a mess on my table. I got these at Home Depot when they looked like they were half dead. And they were on sale because I think they thought they were on their way out. But they were tiny little babies. I got two of them, and they have grown to be quite nice plants, as you can see. And I'm going to talk to you a little bit today about the aloe vera plant. And I'm wearing dirt now. I didn't plan that very well. So anyway, this is my aloe vera plant, and this is what it looks like. As I'm sure a lot of you know this already. I'm sure a lot of you have aloe vera plants. Let me tell you a little bit about it in case you don't know. And I have just lost my place. Aha. Okay, aloe vera plants, this little puppy right here, is in the scientific plant family called Liliaceae. It's usually the fresh juice. It's in the leaves. You just break them, and inside they're very mushy plants. You can feel them. I'm sure you know what they feel like, but they're very spongy feeling, and they're full of juice. And so when you break them off, and then you take the juice, and that's what you use for your medicinal purposes. So it's usually the fresh juice. In some instances, they use the dried plant for internal use, but it's not really recommended. I wouldn't recommend, unless you really needed it for a specific purpose, not to eat the plant or ingest the juice for external use. And I'll tell you what they're about. You can use the fresh leaves at any time because they're all nice, and I'll tell you one thing is you don't want to water these plants real often. It's a succulent plant, and as you may know, they take very little water. Once a week I dump in probably about a cup of water around the plant, just once a week. And out here in my environment, it dries out pretty good. So that's all it takes, though. Just once a week, a cup of water, and it's happy. You can use like I said, you can use these leaves at any time. The fleshy stems are cut open. You can cut them open. What I do is I just take like a little tip off of it. And the jelly-like juice, the gel, is used directly on wounds and burns. It's a healing agent, and it has antibacterial products, or not products, but antibacterial. It's antibacterial. The antibacterial, antimicrobial, antiviral, wound healing accelerator. It's anti-inflammatory. And it's anti-ulcer. It helps keep you from getting ulcers on your skin from like burns and stuff. For internal use, it stimulates smooth muscle contractions. So it will stimulate, and some pregnant women have taken this in small doses to stimulate birth contractions. I don't know anyone who's done that, but in my research, that's what said it can be done. Personally, I wouldn't recommend it unless you know someone who's used it safely internally. It protects against Staphylococcus germs, viruses, and Pseudomonas, herpes simplex 1 and 2. So I know it's kind of used to be anyway, a taboo subject, herpes, but this is very effective if you have herpes to help heal yourself quicker. The first clinical use of penicillin in the United States occurred with the survivors of the Coconut Grove fire in 1942. Pretty much the whole town burnt down. So the burn victims were notoriously prone to severe Staphylococcus infections as a result of the burns. And before early sulfa drugs and penicillin, allopathic physicians knew little about how to prevent those infections. Aloe and honey are perhaps the most two powerful substances that can be applied externally to, did I say externally? Externally. I'm having trouble talking again today, I swear. Applied externally to help speed wound healing and prevent infections in burn victims. This is excellent, like if you burn yourself on the stove or on a campfire, whatever, you know, however you get them, or sunburn, even sunburn. This is excellent to soothe and heal sunburn, which is really handy out here in the desert. One especially important attribute possessed by both honey and aloe is that they are liquid. They keep burned tissue moist, soothe the damaged tissues, and restore lost body fluids, which is a real problem for burn victims, directly through the skin. So they absorb right into the skin, and this is a miraculous plant. I'm sure a lot of you already know about it, but I just wanted to talk about it. It's just for those who don't. They're very easy to grow, and they do multiply. So eventually I'm going to get little baby aloes in here that I can take out and pass on to someone else. So they do grow extensively. Sometimes they can get really big. This one was only like this tall when I first got it. It was so dried out, it was almost brown. So I brought it home and I thought, well, you know, it was only $1 or something. So I thought, instead of, you know, letting them check them all out, I'll just bring a couple home, see if I can get them to live in. And they did. They turned into these nice, beautiful aloe plants. And look how big they've gotten. And you can actually buy succulent plant food to help your plants that are in pots. Okay, at the same time that they help with all the other symptoms I talked about, you know, with the soothing the tissues and restoring lost body fluid, they are potent anti-inflammatories and antibacterial. So this plant is just amazing. It's nearly impossible for a staph infection to get started when either substance is used on a burn, and they're talking about aloe or honey. Clinical practitioners who regularly use aloe report excellent results when it's used on skin wounds of any degree of severity and from any source. You can put these on cuts also. It's like I said, it's an excellent antibacterial, stops infections, and so does honey. Actually, when I have, you know, of course, if you're going to garden, you're going to get bees, you're going to get wasps, and I have been stung, and it hurts like the dickens, you know, especially to get it on your arms and stuff. So I take honey, and I put a glob of honey on where the sting is, and then I put a Band-Aid over that to keep this honey from being rubbed off, and it very quickly relieves the pain, stops any kind of infection, and my skin didn't even turn red. I mean, it was just, and by the next day it was like poof, you know, you couldn't even tell. Preparation and dosage, we've already talked about. I just snip off the end and squeeze the juice out of the part that I cut off onto whatever wound you have. You just slice it or break open the leaves of the fresh plant. Some people call these leaves, I don't know. I call them stalks. I don't know what you really call them. And you can use it as often as needed for burns of any degree of severity. And you want to keep the burn moist. You don't want to let them dry out. Staph infections of the skin of any degree of severity, and herpes sores. So you can apply it all day long as much as you want. And it will definitely keep you from getting infected and help you heal quicker. Okay, the plant was historically used for, believe it or not, constipation in Western medical practice. That's if you ingest it. It's almost never used this way now. The plant is strongly active with potential unpleasant side effects from internal use. And there are easier alternatives for that problem. Drink a glass of prune juice, that'll work. For burns and infected wounds, aloe and honey are both powerful choices. Several research studies have noted that the fresh aloe juice alone is active. Activity declines with time and with any color in change of the juice. The dried plant with the juice extracted has been found to be inert, which means it doesn't work against strep bacteria. So you want to use this plant as it is, cut off a piece, squeeze the juice out of it, and for your any kind of wounds, cuts, and especially on burns. The only other alternative to aloe is honey. It's a less desirable choice. Less desirable choices could include echinacea and St. John's wort for wound healing, acceleration, and to prevent scarring. But you want to use this first. If you have this or a jar of honey, use that first on your wounds, your external wounds. So you guys know all about aloe now. I just think this is a phenomenal plant. I love it, and I do use it. This one doesn't, I haven't taken anything off of this one, but my other plant that I have has some of the points missing because I have actually cut them off to use them. Like on, sometimes like if I'm out working around my property, I'll get a splinter or I'll cut my finger or things like that. And then I'll grab this and rub it into my wound and I don't get infections. So remember this plant, guys. If you don't have an aloe plant, you can keep it in a pot. You know, it's just, it doesn't require a huge pot until it gets big. But I have 2 pots of them here in my kitchen, in the kitchen window. And you just use them when necessary. And they can actually be literally a lifesaver. So that's it for aloe today. Thank you so much for listening. And I hope this has given you some information for those of you who didn't know. And go grab you one of these little puppies. Very easy to take care of. You water a cup of water once a week in a pot this large. You know, of course, if you have a smaller pot, it's a smaller amount of water. Do not overwater them because they really don't need that much water. And if they start looking like the soil needs to be amended or whatever, you can repot it, or you can get some plant food. They have succulent plant food that you can get for these. And that stuff works, let me tell you. So thank you so much for listening. You have a great day, good morning, good evening, wherever you are. And I appreciate you coming by and watching. And I hope you've learned something. So you have a good day. Bye-bye.